Did you know your risk of a heart attack nearly doubles after age 65? That's not a scare tactic, it's a fact. But here's something most people don't hear. It's not age itself that puts your heart in danger. It's the habits you carry with you into your later years. What you do, or don't do, after 60 plays a much bigger role than you might think. The truth is, many seniors don't realize just how much their everyday routines quietly affect their heart health. And that's not their fault. These things aren't often talked about. But today, that changes. The good news? It's never too late to take control. In this video, we'll walk you through 10 powerful daily habits that can help protect your heart and possibly even extend your life. These habits aren't complicated or expensive. In fact, most of them can be done right at home, no prescription. And here's the kicker. The one habit on our list is the one that's most often overlooked, yet it could be the very thing that saved your life. So if you're over 60 or you love someone who is, this could be the most important video you watch all year. Before we jump in, take a moment to hit the like button and subscribe, because we share simple life-saving tips every week just for older adults. Let's get started on this countdown to a stronger, safer heart, because your best years can still be ahead. And they start with taking care of the heart that carries you through them. 10. Stay hydrated, your heart depends on it. Drinking enough water might not sound like a heart health tip, but it absolutely is. When you don't get enough fluids, your blood becomes thicker and stickier. That means your heart has to work harder to push it through your body, which raises your risk of high blood pressure and blood clots, two major contributors to heart attacks. Many older adults drink less water without realizing it. Maybe it's because they don't feel as thirsty anymore, or they want to avoid frequent trips to the bathroom. But this quiet habit can put real stress on your heart. Your body, and especially your heart, needs water to keep your circulation flowing smoothly. When your blood is well hydrated, it flows more easily, reducing strain on your heart and lowering your chances of developing plaque buildup in your arteries. Aim for 6 to 8 glasses of water a day and more if you're sweating, exercising, or living in a hot climate. Don't wait until you're thirsty. Make it part of your daily rhythm. Start your morning with a glass of warm water and sip small amounts throughout the day. If plain water doesn't appeal to you, try herbal tea or add a few slices of lemon, cucumber, or fresh mint for flavor. Staying hydrated also helps your kidneys, brain function, and joint health, all things that become more important with age. One simple way to check: look at the color of your urine. If it's dark yellow, it's time to drink. It's easy to overlook, but drinking water may be one of the simplest, most powerful things you can do to protect your heart after 65. Your heart is working for you. Make sure you're giving it what it needs. 9. Avoid smoking and secondhand smoke. Your heart will thank you. Even occasional smoking or simply being around secondhand smoke can be dangerous, especially as we age. Smoking doesn't just harm your lungs, it hardens your arteries, raises your blood pressure, and forces your heart to work harder than it should. By the time you reach your 60s or 70s, your blood vessels are already more delicate. Adding smoke to the mix creates a perfect storm for a heart attack or stroke. Now here's what many seniors don't realize. Even if you quit years ago, some of the damage may linger, but quitting now still gives your heart a real chance to heal. Within just a few weeks, your blood pressure begins to improve. After a few months, your circulation gets better, and over time, your risk of heart disease drops dramatically. But the risk doesn't stop with smoking. Secondhand smoke is harmful too. If you spend time around others who smoke, whether it's family, friends, or neighbors, you're still exposing your heart to the same toxins. Make your home and your car 100% smoke-free zones. It's one of the simplest ways to protect your health. If you're trying to quit, talk to your doctor or join a support group. There's no shame in asking for help. It's never too late to quit and never too early to start healing. When you finally let go of tobacco for good, you'll breathe easier, feel stronger, and improve your chances of living a longer, healthier life. Your heart has worked hard for you all these years. Now it's your turn to protect it. Leave the smoke behind for good. 8. Move your body 30 minutes a day. Your heart needs it. Your heart is a muscle, and like any muscle, it gets stronger the more you use it. After age 65, staying active becomes one of the most powerful tools you have to protect your heart and stay independent. But don't worry, you don't need to join a gym or take on intense workouts. Just 30 minutes of light movement a day, like a brisk walk around the block, can lower your blood pressure, reduce cholesterol, regulate blood sugar, and improve circulation. It also helps prevent dangerous blood clots and keeps your heart pumping efficiently. You have options: walking, gentle yoga, swimming, tai chi, or even dancing in your living room all count. The key isn't intensity, it's consistency. Do what you enjoy and do it regularly. And don't underestimate the power of breaking up long periods of sitting. Every hour, make it a habit to stand up, stretch, or take a lap around the house. Even a few minutes of movement can ease stiffness, boost your mood, and give your heart a break from being idle. Physical activity also supports your mental health, improves sleep, and helps manage stress, all of which are good for your heart. If you struggle with joint pain or balance issues, talk to your doctor about safe seated exercises or a physical therapist guided routine. The worst thing you can do is do nothing. So start small, but start today. A healthy heart begins with just one step. Move more, sit less, and give your heart the daily workout it needs to keep you strong, sharp, and full of life. 7. Cut back on salt and processed foods. Your heart will thank you. Too much salt may not seem like a big deal, but for older adults, it's one of the most dangerous hidden threats to your heart. Salt causes your body to retain water, which increases blood volume and puts added pressure on your heart. Over time, that pressure leads to high blood pressure and thickened arteries, two major risk factors for heart attacks and strokes. And here's the thing, after age 65, your kidneys aren't as efficient at getting rid of excess sodium, which means the damage happens even faster. The real problem? Salt is sneaky. It hides in everyday foods you might not expect: canned soups, frozen dinners, sauces, condiments, even bread. That's why it's so important to keep your daily sodium intake below 1,500 milli, which is about 2/3 of a teaspoon. Read labels carefully. Look for low sodium or no salt added versions of your favorite foods. Cook at home when you can so you stay in control. Instead of reaching for the salt shaker, season your meals with heart-friendly herbs and spices like garlic, basil, rosemary, turmeric, or lemon juice. Skip the salty chips, pickles, and prepackaged snacks, and fill your plate with fresh vegetables, fruits, whole grains, and lean proteins. Reducing salt doesn't mean giving up flavor. It means choosing a longer, healthier life, and your taste buds will adjust in just a few weeks. This simple shift can protect your heart, improve your blood pressure, and make every bite a step toward better health. You don't have to make drastic changes overnight. Start with small swaps and stick with them. Your heart will notice, and one day so will you. 6. Get regular heart checkups, even if you feel fine. Just because you feel okay doesn't mean your heart is. That's why regular checkups become so important after age 65. Many older adults live with high blood pressure, high cholesterol, or early heart damage without even knowing it. These conditions often develop quietly, showing no symptoms until it's too late. But a doctor can spot the warning signs long before you feel anything. At a minimum, have your blood pressure checked every few months, especially if you're on medication. And don't skip your annual blood work. It helps monitor cholesterol, triglycerides, and blood sugar. These numbers give a clear picture of how hard your heart is working. If you're at higher risk, whether from family history, diabetes, or past smoking, ask your doctor about an EKG, electrocardiogram, or a stress test. These simple, painless tests can detect blockages or irregular heart rhythms before they lead to a heart attack or stroke. Don't wait until something feels wrong. Preventing a heart emergency is always easier and safer than treating one. Regular checkups also help guide your choices. They can shape the foods you eat, the activities you choose, and the medications you might need. Sometimes one simple test today can prevent a trip to the ER tomorrow. So stay ahead of the game, be proactive, know your numbers, ask questions, show up for your heart. You've taken care of others your whole life. Now it's time to take care of yourself. Because when it comes to heart health, what you don't know really can hurt you, but what you do know might just save your life. 5. Lower your stress, protect your heart. Stress isn't just in your head. Over time, it can be a silent killer of the heart, especially after age 60. Chronic stress floods your body with hormones like cortisol and adrenaline, which raise your blood pressure, harden your arteries, and weaken your heart muscle. And while most people think of stress as something that fades with retirement, many older adults face hidden emotional burdens: loneliness, financial concerns, health worries, or grief that quietly wear on the body. Unchecked stress doesn't just steal your peace of mind, it can lead to inflammation, poor sleep, overeating, and even irregular heart rhythms. But here's the good news, you can take back control, one small habit at a time. Start by carving out a few minutes each day for intentional calm. Simple practices like deep breathing, gentle stretching, or sipping tea in silence can make a world of difference. A 10-minute walk in the fresh air, soft music, a phone call with a friend who makes you smile. These little rituals relax your nervous system, which helps your heart find its rhythm again. Try writing down 3 things you're grateful for each day. It's a small act that can shift your focus away from worry and toward peace. Avoid stressful news, loud phone calls, or overstimulating TV right before bed. And most importantly, don't carry your worries alone. Talk to someone, a friend, a family member, a counselor. Your heart and your mind are deeply connected. When you calm your thoughts, you protect your heart. Stress might be invisible, but its damage is very real. That's why it's essential to turn peace into a daily habit, not an occasional treat. Before we move on, if you're serious about staying strong and healthy after 60, this is your moment to take the next step. Click the join button below or tap the pinned comment link to unlock exclusive senior health tips, early video access, and weekly wellness guides created just for members. It costs less than your morning coffee, but the value could last a lifetime. Thousands of people are watching, but only a few are acting. Don't miss your chance. Join now. Because the path to a healthier heart isn't about doing everything at once. It's about doing something today. 4. Manage your blood sugar, even if you don't have diabetes. You may think blood sugar isn't something to worry about unless you have diabetes, but that's a common and risky misunderstanding. After age 65, keeping your blood sugar in check becomes essential to protecting your heart. Why? Because high blood sugar, even at borderline levels, can quietly damage the delicate lining of your blood vessels, making it easier for dangerous plaque to build up. Over time, this can lead to narrowed or blocked arteries, increasing your risk of heart attacks and strokes. Seniors with type 2 diabetes or insulin resistance are especially vulnerable, but even those without a formal diagnosis should be aware. That's why monitoring your blood sugar regularly, especially if you often feel unusually tired, thirsty, or experience blurry vision, is one of the smartest health habits you can adopt. The good news? You don't need extreme diets or expensive supplements to take control. Start with balanced, heart-friendly meals that are low in added sugars and refined carbs. That means swapping out white bread, soda, and sweets for whole grains, leafy greens, and fiber-rich fruits like berries and apples. Watch your portion sizes too. Don't overload your plate. Instead, build meals with healthy fats like avocado or olive oil and lean proteins such as chicken, beans, or fish. These help slow digestion and prevent sharp spikes in blood sugar. One simple habit that can make a real difference: take a gentle 10 to 15-minute walk after meals. Research shows it helps your body process glucose more efficiently and lowers post-meal blood sugar levels. If you're on medication to manage your blood sugar, take it exactly as prescribed. And don't hesitate to check in with your doctor before making changes to your routine. Your care team is there to help you stay ahead of complications, not just react to them. Keeping your blood sugar steady is about more than preventing diabetes. It's about giving your heart the best chance to stay clean, clear, and strong so it can keep doing its job without unnecessary strain. A healthy heart and steady blood sugar go hand in hand, and the steps you take today, whether it's making smarter food choices or walking after dinner, can protect you from serious heart trouble tomorrow. So don't wait for a diagnosis. Be proactive. Your heart depends on it. 3, keep your cholesterol in check. Give your heart room to breathe. You may not feel it, see it, or even know it's happening, but high cholesterol is one of the most silent and deadly threats to your heart, especially after age 65. Over time, excess cholesterol builds up in your arteries like rust in old pipes, slowly narrowing the pathways your blood needs to travel. This buildup, called plaque, reduces circulation and greatly increases your risk of a heart attack or stroke. What's even more concerning, many people don't even know they have high cholesterol until it's too late. That's because it doesn't cause pain or obvious symptoms. It just keeps building quietly and dangerously. As we get older, our bodies become less efficient at processing fats. So even if you've always eaten moderately, your cholesterol levels can start creeping up without warning, especially your LDL, the so-called bad cholesterol. And that's where things get tricky. LDL cholesterol is the main culprit behind plaque buildup. The higher it goes, the more your arteries clog, putting strain on your heart and brain. On the flip side, there's HDL, the good cholesterol, which helps clean out your blood vessels. Your goal? Keep your LDL under 100 and aim for HDL over 60. Well, how do you take control? Start with your plate. Cut back on fried foods, red meat, and full-fat dairy, which are loaded with saturated fats. Instead, fill your meals with heart-loving ingredients. Oats help lower LDL. Fatty fish like salmon provide heart-protecting omega-3s. Nuts and seeds, especially almonds, walnuts, flax, and chia, support healthy cholesterol balance. Olive oil is a smart swap for butter or margarine. Fresh fruits and vegetables offer fiber and antioxidants to protect your arteries. Small changes like these can make a big difference over time. Sprinkle ground flaxseed into your oatmeal, toss some chia seeds into your smoothie, or snack on a handful of almonds instead of chips. But diet alone may not be enough. That's why it's important to get your cholesterol checked at least once a year. A simple blood test gives you and your doctor the numbers you need to stay ahead. If your levels are too high, your doctor may recommend medications like statins to help bring them down safely. These can be lifesavers, literally. Don't ignore high cholesterol just because you feel fine. Think of it this way. Managing your cholesterol is like clearing out the plumbing in your heart. It keeps your blood flowing smoothly, reduces pressure on your heart, and gives you a better shot at a long, active life. Remember, heart disease doesn't happen overnight. It's the result of years of silent buildup. But it's never too late to make a change. With a few smart habits and regular checkups, you can keep your arteries clean and your heart pumping strong. Your heart has carried you through life. Now it's time to return the favor. Too hard. Keep a close eye on your blood pressure. It could save your life. High blood pressure, or hypertension, is often called the silent killer, and for good reason. It can quietly damage your heart, blood vessels, kidneys, and even your brain without showing a single symptom. You can feel completely fine and still be at serious risk. That's what makes it so dangerous. After the age of 65, blood pressure tends to rise naturally. That's why monitoring and managing it becomes more important than ever. If left unchecked, high blood pressure can lead to heart attacks, strokes, kidney failure, and memory problems. But what's the ideal target? Doctors generally recommend keeping your blood pressure below 120/80 mSHg. Once it consistently rises above 130/80, your risk of cardiovascular events begins to climb significantly. The good news? You don't have to be in a clinic to keep track. Today, there are affordable, easy-to-use home blood pressure monitors you can use daily or weekly. Choose a quiet time, preferably in the morning. Sit down, relax, and take your reading. Keep a small notebook or use a tracking app to log your numbers. That way, you and your doctor can spot patterns before they become problems. What if your readings are too high? Don't panic, but don't ignore it either. Start with simple heart-healthy habits. Cut back on salt, especially hidden sauces like canned soups, sauces, and processed snacks. Stay active, even if it's just a daily walk or light stretching. Maintain a healthy weight, as even small losses can improve your numbers. Limit alcohol and caffeine, especially in the evening. Practice relaxation techniques such as deep breathing, gentle yoga, or simply taking quiet moments for yourself throughout the day. Stress plays a bigger role than most people realize. A tense conversation, a restless night, or even too much news can cause temporary spikes. That's why learning how to calm your mind can actually protect your heart. If you ever feel overwhelmed, take a few deep breaths and give yourself a break. Your heart will thank you. And also, don't worry if one reading seems high. It happens. What matters most is the pattern over time. But if you notice consistently elevated numbers, talk to your doctor. Medication may be necessary, and the earlier you start, the better your outcome. Monitoring your blood pressure isn't just about numbers. It's about awareness. It's about catching a threat before it becomes a crisis. It's one of the simplest, smartest ways to stay independent, avoid hospitalization, and enjoy your later years with more energy and confidence. So don't let high blood pressure sneak up on you. Make it part of your weekly routine, just like brushing your teeth or checking the mail. Because in the end, knowledge truly is power, and in this case, it could save your life. And daily action, not occasional effort. That's what protects your heart. If there's one golden rule for heart health after 65, it's this: what you do every day matters far more than what you do once in a while. Caring for your heart isn't about a miracle food or the occasional healthy meal. It's about daily habits, those small, consistent choices that quietly add up over time. Every time you skip the salt, drink an extra glass of water, go for a walk, check your blood pressure, or say no to added sugar, you're not just helping your health, you're choosing life. Heart attacks don't happen overnight. They build up silently, day by day, through years of small, harmful decisions. But here's the good news. You can reverse that risk the same way it was created, one smart choice at a time. No supplement, no fancy prescription, and no expensive treatment will work if you don't make the commitment. That means planning your meals in advance, getting your body moving even when you don't feel like it, keeping up with doctor visits, and saying no to excuses. Your heart may be aging, but that doesn't mean you have to give up. It means you need to be wiser, more intentional, and more disciplined than ever. The one way to protect your heart is no secret. It's the quiet daily discipline that builds resilience over time. And that discipline starts today with you. So let's take a moment to reflect. What change will you start today? Which habit from this series speaks to you the most? We'd love to hear it. Drop a comment below and share your favorite takeaway. And remember, you don't need expensive treatments or complicated routines to stay healthy. What you need are real, simple, consistent actions. Drink more water, move your body, cut down on salt and sugar, manage stress, monitor your numbers. These aren't just tips. They're your daily armor, your defense against heart emergencies that may be years down the road. But action must start now. We've now covered 10 powerful habits that can protect your heart and extend your life after 65. You don't need perfection, just persistence. Heart disease doesn't announce itself with warning bells. It hides in the everyday. But that's also where the solution lives, in the everyday choices you make. If this video helped you, please click like, hit subscribe, and turn on notifications so you never miss another life-saving health update. And if you're ready to take your heart health more seriously than ever, check out the pinned comment below and become a member of our exclusive community. You'll get early access to new videos, weekly principal PDFs, bonus health tips, and content created just for members for less than the cost of a cup of coffee. Your best years aren't behind you. They're still ahead, so take charge today. Stay strong, stay smart, and most of all, take care of your heart.